Oh my goodness. I'm so happy to be back here. Thank you everybody who's tuning in both online or on podcast on your podcast vehicle of your choice. My name is Brad Finegood. This is my second time back here in the studio, recording for a King County Recovery Coalition Presents episode. And I can't even tell you how excited I am. I'm here with an amazing colleague and friend of mine, Jennifer Winslow, who's here to talk about a really game-changing and phenomenal endeavor that King County is going through currently, transforming our system of care for people who are out there struggling both with substance use disorder and mental health conditions, called crisis care centers. That is multidimensional, and we're gonna get into the conversation here in a little bit. And I'm so excited that folks out there can join us today. So I'd love for you, Jennifer, to introduce yourself to everybody out there in the recovery community and beyond who's here with us today.
I don't know, Brad. You did a pretty good job for me there. Hello, everyone. My name is Jennifer Winslow. I use she, her pronouns, and I am the Crisis Care Center Strategic Planning Manager. I am a licensed mental health clinician, and I'm also a licensed professional counselor in the state of Missouri, but that has no relevance here in Washington State.
But it does say something about all of your background, all of your credentials, and how amazing you are.
Well, that's fair.
To
Yes.
lead this
Okay.
effort
Yes.
for the county. So Jennifer, let's just jump into the conversation and talking about crisis care centers, because when the crisis care center proposal first came to the voters of King County, as somebody who's worked in this field and in this community for a long time, I couldn't even begin to tell you how excited I am to even imagine what this is. So what are crisis care centers? What's the crisis care center or the whole crisis care proposal levy that the voters funded? And what does it entail?
Yeah. I was thinking about this as I was driving downtown, and I can't believe it's been about 2 years already, right? So the Crisis Care Center levy passed in April of 2023, right?
It's been,
I know.
Time flies, right?
Time has really, really flown. I was like, it's only 24 right now. No, we're in 25. So this was a voter-approved levy that passed in April of 2023. And essentially, it is a levy that will support the creation of a network of crisis care centers, as well as building back mental health residential beds, as well as providing funding to support our behavioral health workforce. So from the levy, once that passed, part of the ballot measure ordinance told us that we needed to essentially write an implementation plan. This is a high-level budget and policy document that essentially describes how we will spend the funding over the next 9 years. And so we had roughly about 6 months or so to write that, myself and two wonderful humans, Dr. Matt Goldman and Kate Baber. And between the three of us and lots of support from other folks, we were able to get that transmitted. And then it went in front of council. Council did their thing. They were in support of it entirely. And then the implementation plan passed just June of 24.
So exciting.
About a year later, yes. And so that ultimately gave us spending authority on all of the ways in which we described how we would spend the money. And so that's when things became like really real for us. So what is a crisis care center, right? So a crisis care center is essentially this really big building that will be able to provide behavioral health supports for a person that may be experiencing a crisis. There's 3 components. There's the behavioral health urgent care, there's the 23-hour observation, and then there's also the 14-day stabilization unit. And I think what makes crisis care centers so great is because we finally will have an additional resource to help fill in that gap. When we think about just our crisis continuum as a whole, the big piece that's always been missing for us is somewhere safe for a person to go. Mm-hmm. And so a crisis care center will serve to help support the continuum as a whole. Oftentimes, unfortunately, people find themselves either in the ED or perhaps even in jail. Mm-hmm. And so this serves just as an alternative for folks to be able to say, hey, we need somewhere else to go. And, I think the best part about it is it's like 24/7, that behavioral health urgent care. So how many times have you found yourself in a crisis at 3 o'clock in the morning, right?
Yeah.
We think that a crisis is Monday to Friday, 9 to 5. That is not the case,
Yep.
right? And so I think it's really great that we'll be able to have this resource. However, crisis care centers are big buildings and they take a lot of time to build ish. And so we wanted to make sure that there were investments within our system right now that can kind of help support in preparation for crisis care centers coming online. So the levy describes some opportunities for us to do some early crisis investments
So
around mobile crisis expansion, as well as naloxone vending machines, so assistance with SUD, as well as investments in residential and then also workforce, which, as mentioned, are two other components of the levy. So while a crisis care center and establishing that network is the paramount purpose, we then like to say that mental health residential and workforce development are going to be the two supporting purposes, but they all tell a story.
Sure.
When you think about just like the connectedness of mental health residential, but then
whole
also
system of care, right?
Workforce. So we think about, you bring these buildings online, you bring these great resources, and then you think, well, who's going to staff these buildings, right?
Sure.
So for us, it was really important to make early investments. And so we were able to invest into our behavioral health workforce just in 2024. This, of course, will be an investment throughout the life of the levy. But the one thing you really have to do is you have to build that behavioral health pipeline. All right. We've been joking of like, where do you find folks? Should we go to like the local preschool and start recruiting?
Right.
But
workforce has been a huge issue for such a long time.
And it will continue to be, I think about even my own experience and how you see folks kind of hop around for opportunities. So they may go from one agency to the next, rightfully so. And so we're now adding another resource, which may increase the chances of people going to work for crisis care centers. And that's great. They'll get additional supports and opportunities. However, you've got to be able to build and get people and funnel people into the actual system. So making investments to help build that, but then also retain our existing workforce. And then also increase representation so that we have a workforce that's reflective of the communities that it's serving.
Because it's so important when somebody walks in to receive care that they see and talk to somebody that they can relate to, right? Somebody who that looks like them, who may speak the same language as them. We're such a diverse community of individuals who have such a diversity in enriching lives and experiences, but also in challenges, right?
Absolutely. I think that's key. When you walk into a crisis care center, that first interaction you have with somebody can either make or break that entire experience, right? When we think about just crisis work as a whole, how many times have we probably escalated a crisis even more, not even realizing maybe it's the way we talked or the way we postured or just even our body language, things like that. So really being able to train a workforce into crisis, but then also having a diverse workforce is going to be key and just like super important for crisis care centers.
Yeah, so good. While you're talking, one of the a question that I thought about, I was like, how does 3 people write a report like that big? Like, do you guys go every other word? Is that no? I'm just joking. I'm just kidding. But it really just goes to show like what a big effort something like this is. We're constantly in positions where we're talking to people, having conversations in the community where they're like, well, where should I take somebody? Like, where does somebody go? How do I get my family member help? Can you and for so long in our system of care, sometimes like there's not an easy answer. Can you talk maybe a little bit how like crisis care centers like fit that mold and why it's so important to have like no barriers or low barriers when people need the help that they need?
Absolutely. I always like to just kind of reflect even on my own personal experiences and people in my own kind of circle. And when I think about even being in a crisis, you're not receptive to what people are saying, not because you don't want to, but because the emotions are heightened and things are kind of swirling, right? And so having those around that can kind of help ground and level set, I think is just such an important resource. And so crisis care centers are really great because there's that no wrong door approach, meaning I don't have to know what is wrong. I think one thing about a crisis that's so important is the person defines their own crisis. So what I may think is a crisis, you may not necessarily think is a crisis, right?
Absolutely.
I think the simplest way I can reduce that is when a person's stressors are outweighing their resources. So those stressors may be anything, right?
Such a good way, interesting way to
Right?
think about it.
Food, food scarcity, financial, housing, even something down to like withdrawal management
Yeah.
or, symptoms of depression or anxiety. Maybe your partner just broke up with you. Who knows,
Yeah.
right? And so crisis care centers and that no wrong door approach are so great because one, that says you get to define what your crisis is.
Yeah.
And there's someone on the other side that gets to say, okay, what is your crisis? And how can I help to support? How can I help to triage and assess what is it that you really need? Is it just something in that behavioral health urgent care in which we can get you connected with services? Or maybe you do need a higher level of support in which we can move you through into one of the other kind of components of a crisis care center. But that no wrong door approach really just lets a person know that I may not know what I need, but I have a safe place that can go help me to determine what it is that I do need.
Man, that's so. I mean, the way you described it, the only thing that was going through my head while you were talking about it was, God, I'm glad we have people like you in our community to lead the effort, truly, right? Like the human-centered approach, the human-centered design, based upon, experiences that people have had. And, you mentioned previously, we've had two options in the past, right? We can, when people are struggling and they're in a crisis, I mean, really, people can go to jail and people can go to the emergency department. And we know that there's been a lot of harms caused in both of those settings. In jail, it's just not a I mean, the nature of what incarceration is, it's not a rehabilitative setting. It wasn't made for that. And in emergency departments, emergency departments may be well-intended to give acute care, but not really set up, right, to triage. And so when I hear you talk about crisis care centers, I really talk about like a new vision of like what a front door looks like for a system of care. I think about conversations that I've had with people where they've called me and they're like, how do I get my kid care or how do I get my loved one care? And, the first question is, what insurance do you have, right?
Yes.
And so I just think about that no wrong door that you were describing. So what is it that somebody can really expect if they end up needing the help of a crisis care center? How would somebody even access that now or in the future? We can talk in a little bit about like where we're at as far as implementation goes, but like what should somebody even somebody who maybe doesn't trust the system because of experiences they've had in the past, like what could somebody expect?
That's a great question. And trust is like the one word that keeps going through my mind because when we think about, individuals who can utilize these services, we want to make sure when we say no wrong door, that everyone has the ability to receive services despite their ability to pay. So when we think about payment, of course, there's private insurance, there's Medicaid, there's Medicare, but there's also the ability for someone who's uninsured to come in and receive services, despite, even their gender, sexual orientation, status, whatever the case may be, again, it is what people can expect. I always like to think that they can feel safe, one of the things we've been doing within the Behavioral Health and Recovery Division is really focusing on how we can help folks feel seen, heard, and understood.
So
right.
Good.
And so if I think about just that concept, how can we make sure that folks come through a crisis care center can feel seen, heard, and understood? Right. So coming in, again, that person gets to find their own crisis. And I think a big piece around kind of crisis management is education, right? It's validation. How many times have you heard someone say, well, my problem's not as bad as someone else's? Or like, oh, I have this, but there's someone well off, there's someone worse than me.
Totally.
Or X, Y, and Z. And so normalizing, again, you get to define what that looks like for you. And so coming in, this is a walk-in. Anyone can access, again, no wrong door. You get to come in. It's 24/7.
So somebody could pull up
Yes.
at like 3 in the morning or 1 in the afternoon
Yes.
if there's a struggle that they're experiencing
Absolutely.
or bringing a loved one.
Absolutely. And, oftentimes people are like, I don't know where to go. I don't know what to do. I don't know what even my options or my resources are.
Yeah.
Right. And so, yes, you can walk in, you can take public transit, you can
Yeah.
drive in, whatever the case may be, And so that's the behavioral health urgent care component. Now, there is a spot for law enforcement and first responders that is in the 23-hour observation. So they will be able to bring that individual straight in into kind of that component to assess like what it is that a person may actually need. And so
Same front door?
front door, back door.
Okay.
Side door, if you think
Okay,
about
yeah,
it.
sure,
So
sure.
no, they won't be utilizing the literal front door.
Sure.
But it is a front side door.
Yeah.
If that makes
so
sense.
somebody who's like wants care but is afraid of showing up at the same time.
Correct.
Police are they won't
They won't run into each
They
other.
won't run into
Correct.
each other,
Yes.
great.
That there's a separate component. One of the things we were thinking about when we were creating, crisis care centers and all the components, we really centered a lot of our work on community feedback.
Oh, so good.
And community feedback, there were, concerns around,
Yeah.
can I come in? Am I going to be safe? I've had a bad experience. Unfortunately, in this incident, maybe even with the law enforcement, I don't want to come if they're going to be there. And so by having kind of a separate entrance,
Yep.
you are safe from that.
Yeah.
And, first responders know they have a job to do. They
Yep.
come in, they drop off, and they head out so that they can support other members in the
Yep.
community.
Yep.
So safety, we want folks to feel seen, heard, understood, and then valued.
Yeah. So when somebody comes in for that behavioral health walk-in, right? That first experience, like who are they going to end up talking to? Like what type of professionals or folks do peers play a role? Like what is that? What are they going to experience and who are they going to end up talking to?
I'm glad you said that because I am going to make a shameless plug about centers will need staff and come join the workforce, right?
Totally. This is the right opportunity and time, especially for all the folks out in the recovery community
Yes.
who are listening, who have experienced many our peers in the community. Absolutely.
Or say, I want to get involved and I don't know how to get involved,
Yeah.
right?
Yeah.
So that first person that they're going to meet is a peer.
Yeah. Oh, amazing.
I know, right? So you said that. I'm like, are you setting
So
me
it's
up
not-
for
yeah.
the response?
Yeah. It's not going to be somebody who's like somebody in a lab coat or something
Correct.
like that. It's going to be a peer, somebody who can
Absolutely.
welcome somebody into that space.
Absolutely. Crisis care centers will be staffed with peers, behavioral health techs, as well as mental health professionals, substance use professionals, nursing, psychiatry services, just kind of that whole gamut. But that first person that they're going to see is going to be a peer, someone that's going to say, I got you. You're good.
So good. So
right?
safe.
Because how many times I think about myself, not even wanting to walk into a situation because I don't know what I'm going to expect.
Yeah.
The fear of the unknown keeps us stuck sometimes.
That's totally right.
Right? And so, again, that first person can make or break your experience.
Yeah.
And so if there's a face that says, I got you,
Yeah.
or come on in,
And you're safe with me,
you're
right?
safe.
Yeah.
Yes.
And just for the record, that question was not rehearsed. We did not. I did not know that. But it's just such a welcoming. That when you think about the design, the thoroughness that you all went through in the design process, and being able to take feedback, and that that first impression that people receive, it's just amazing to think about the thoughtfulness that you all went through.
Absolutely. It was really great in the writing of the implementation plan that essentially described the components of a crisis care center. Because this was approved by voters, we knew that voter voice was so important,
Sure.
and so community engagement.
Yeah.
How can we make sure that they're involved in this process? But also, how can we make sure that we're not sharing power that we don't have? Or that we can't give, I should say.
Yeah.
And so being very thoughtful around how we did focus groups, listening sessions, and then also then connecting back with folks and saying, this is how your feedback was incorporated into the implementation plan.
Yeah.
But then also starting the relationship building. We didn't want this just to be a one and done.
Sure.
I come in, I check the box, I say I met with this group, on to the next. And so to that point, one of the really great parts about the work that we're doing, even within the county, is we hired a community engagement liaison.
Oh, nice.
Who is responsible for staying connected to community. Once these centers are up, now we want to know, are we doing what we say that we're going to do?
Yeah.
Right?
That accountability, right?
It's the accountability. Absolutely.
I love that.
Absolutely. You know, so we as the county will not be operating these crisis care centers.
Okay.
I think that's been something that folks have thought. We will actually be putting these out for bid. And so community behavioral health organizations, behavioral health agencies, they can apply through kind of a competitive procurement process.
Sure.
And we then will kind of select those operators. However, as the county, we will, again, oversee and make sure, since we are creating a network of crisis care centers, that folks are doing what they say that they're doing.
Yeah.
And that if I go to a center here and I go to a center here, there's a similar understanding of like the components, so that I'm not like, they do this in the South, but they do this in the East, right?
Sure. So that there's like a standard of care.
Absolutely.
Right.
Yes. Yes.
Man, I know that I totally want to get to like, where are we? But like this conversation is so good that I keep having more and more questions about like about the work that you all are doing, because it fascinates me. And it's such, I mean, for me, it's an example of just like good government, right? Like really like thinking about who needs the help most, and then really being authentic with community and transparent with community. So can you talk a little bit more about some of the community engagement that happened in the lead up to it? Like, I would imagine there's so many different stakeholder groups that are really important to get feedback as you design.
Absolutely. You know, so when we think about community engagement, oftentimes people think about professionals. So we think about our system partners and we think about like our government partners. And those are two really important groups.
Yeah.
The one group that oftentimes is forgotten is actual community.
Yeah.
Right? Like actually those that are either connected to organizations or folks that just don't trust.
Yeah.
Right? And so we wanted to make sure that in our community engagement that we really were like, who are we missing?
Yep.
What are those groups?
Yep.
Like, we know who exists because the same people show up at the table every single time.
Sure.
But who are the people who don't show up to the table because, one, they have never felt included and or don't even know that there's a table and that their voice is so important. So community engagement early on, we hosted monthly community meetings where we could just be transparent about what it is that's happening each month, where we at with the process. You know, we held this both during the afternoon, but then we also recognize who's available in the afternoon.
Yeah.
Most of the times those are professionals.
Yeah, who are getting paid to be there.
Who are getting paid to be there.
Yeah.
So we saw the same people. So then we included an evening. And so we wanted to kind of open it up and get a different sort of group and get, that is a different experience.
Yeah.
So we did community meetings monthly. We also did focus groups. We targeted intentional efforts around communities of color. We also wanted to work with our veteran partners.
Yeah, sure.
And so to that point, within the Department of Community and Human Services, there's different divisions.
Sure.
And so we partnered with our Adult Services Division to do some listening sessions for aging and older adults, as well as our veteran community. We wanted to make sure that we were able to talk to not only individuals that work with youth, but youth themselves.
Yeah.
And I will probably say that's the best group, because they will tell it to you straight.
They sure.
They were like, nope.
Yep.
What is this?
Yeah.
Yes. What is this? I'll come, but you better have some snacks.
Yeah, right.
Or you better have X, Y, and Z.
Yeah.
But it was so authentic because we were like, dang, you're right.
Yeah.
We should do that.
Yeah.
And so community early on, we got all of this feedback, and then it actually shows up in the implementation plan, like how that community engagement showed up. These are the themes, as well as there's this like behavioral health equity box. So like, how do we actually take this feedback and incorporate it into this plan? And so there's lots of opportunities there. We also went on field trips. We went down to Arizona. We went to San Diego. We went over to Spokane. We recognized that we needed to be very humble in this because we don't know everything.
Yeah.
And there's so many people that have so many great things to say.
Yeah.
And we wanted to just make sure that we were open and listened.
I was going to ask, like, is this the first of its kind in the country? Like, there models? Like, what was this based upon?
Slight flex, it is.
Sure.
So there are, of course, there are crisis
cool.
care
I mean,
centers.
if you,
I mean, it's a little light work, not gonna lie. There's individuals that are kind of set up. The model of a crisis care center is like the national standard of care.
Yeah.
And so to that, I'm not gonna say we did not do that.
Yeah.
There are models around the country,
Yeah.
and so we were able to take that. What makes King County so unique is we are creating a network
Got it.
of crisis care centers. So this isn't just a one stand up.
Yep.
There will actually be 5 crisis care centers.
Okay.
So we like to consider them 4 as regional crisis care centers. And what that just simply means is that it is open to everyone, including youth, and that behavioral health urgent care component.
Okay.
And then that 5th crisis care center will be youth focused only.
Okay.
And so that can be located anywhere in King County, but there will at least be one in the north, the south, the east, and then central.
Okay.
But just because they're located there does not mean that you are like confined to
Beholden
only
to
go
only
there.
go
Yes,
there, yeah.
it is simply for the purposes of resource allocation and making sure that areas have resources. But I live in the south, and if I'm in a crisis. In the north, I'm not driving down south to be like,
real.
I need to go down here.
Yeah.
You can access a crisis care center anywhere.
Yeah.
So it's just
a total open front door if you show up. Tell me a little bit about the youth facility, the idea behind like 4 sort of regional ones that are unconditionally open, and then there's going to be one youth specific facility.
Because children are the future, Brad.
Yeah,
You know this,
I mean,
right?
my children tell me that also. They like to remind me that.
I am the future.
That's what I'm saying.
No, that was one of the things we heard as well is there's a lot of resources for adults, but what about youth? We need something for youth. And so we wanted to make sure that there was a center dedicated specifically for youth. However, we also wanted to make sure that youth could still access one of the 4 crisis care centers, even through that behavioral health urgent care component, thinking about it as a triage.
Yeah.
Like, can they actually get their needs met in this component? Or perhaps we need to take somewhere else, like Children's Hospital or whatever the case may be, but it provides an opportunity and a front door.
Great.
And so when we think about youth, we think about what is your staffing model going to look like for that when we think about peers. And so that's why it was so important for us to actually talk to youth and say, this is something that's going to be here for you all.
Yeah.
What do you want that to look like?
Yeah.
And surprisingly, they were like, we want cool colors. We want pictures on the wall. We don't want this to look like a hospital. Like, it needs to be a vibe.
Yeah.
So, we don't have direct oversight,
Right.
but one of the things we're going to make sure that when our selected operator for the youth, you need to make it a vibe.
Yeah.
Because that's what kids want.
Yeah, and really in a place where youth can relate and connect. I've seen so many amazing youth ran and led places, and it just is that vibe that younger folks can connect to. So that, I think, is a good transition into the so where are we now in the implementation? I heard a lot about go first strategies, which was amazing that you all are not sitting back and waiting for big construction to happen. I also know that there's been a lot of work going on to make this really a dream of a new front door become reality. So can you update us on where that is?
Anytime I think of construction, I laugh because fun fact, I am behavioral health. I am mental health. That's like my will.
Yep.
Everyone in my family is into construction and design. And so I always joke with them. I'm like, I'm not part of the family in that sense.
Yeah.
And so now I'm actually involved in sort of this capital component. And so I can't tell you the number of times I've called my dad and been like, what is this assessment? Or what am I doing? And he just chuckles and he's, and so I'm like, I guess I'm part of the family now because somehow.
Finally,
I'm finally part of the family. I'm not going to tell you how old I am, but after all these years, I'm finally welcome and I can contribute to the conversations in the family. But where we're at now, right? So
rites of passage,
Exactly. I officially got my wings. So again, 5 crisis care centers. And so we currently have awarded our first crisis care center, and that is to Connections.
Congratulations.
Yes. Yes.
Huge.
So they will serve as a crisis care center in the north.
Okay.
And so currently
So there's already a facility.
Already a facility.
Amazing.
Yes. And the best part, here's my also shameless plug, is anyone can access that facility, right? So again, it's not
So
just
there is a
bound.
place right now that like this whole panacea of like an amazing like care center that we've been talking about for the past half hour, like
Already exists.
it's already there.
Yeah. Yeah.
Amazing. Okay.
That's what I'm saying.
So good.
And then we'll be able to select 2 more operators
Okay.
during this first round. So
Okay.
our plan right now is to have 3 rounds of procurement.
Okay.
With the selection of 3. Hopefully we get all of our operators selected this year.
Sweet.
But our next round actually closes next week. And so we're all in
You're
anticipation.
in it.
Yeah.
Yeah.
The goal is to select 2 more operators, and then we will open up a second round of procurement here later in 2025
Wow.
with the goal of selecting our last 2 operators. And the reason why we wanted to do this early on in like 2025, when
Yeah.
you think about the life of the levee goes to 2032,
Yeah.
is because what I've learned, construction takes time.
Sure does.
And so even awarding an operator in 25, they may need time to build a building
Right.
or renovate a building
Right, get up
or
and moving.
buy a screw or a nail or whatever they do. I still don't know all the logistics of actually building, but what I'm learning is that there's a timeline.
Yeah.
And so we want to make sure we invest on the front end so that folks have an opportunity to get these up and going as soon as possible.
Yeah. So amazing. So the audience for this is the recovery community, right? This is King County Recovery Coalition, and the Washington Recovery Alliance. I would imagine there's international, folks.
Probably my family.
Probably your
I
family.
told them, and so they're like, "Send me the link," and I'm like, "No."
Dude, this is your second, right? Like,
Yeah,
you're like,
yeah, they're actually proud of me. No, they're always proud of me. No, they're always proud of me. But of course, they're like, "Send us the link." Maybe.
You're like, let me watch.
Let me
first."
watch first. Let me make sure like this is a good side, and I'll send them like stills or something.
I mean,
but
right? Like
for
we
the most
chose
part-
we chose our sides very strategically.
did we? Did we? We're not going to put that on camera, Brad. Did we? Okay.
So for the recovery community out there, I mean, as somebody who's very connected to the recovery community, like I'm super excited. I mean, maybe in your own words, you can tell the recovery community why you think that this is such a game changer for recovery, right?
Absolutely. I think one of the most important things about recovery is like recovery is possible.
Yeah.
Right. And so
Yeah.
oftentimes I think people forget that and it can feel discouraging.
Oh, so,
right.
yeah.
And so for folks,
If they can't access that first step, right?
yeah, exactly. And so recovery is possible, and crisis care centers help to support
Yeah.
that recovery is possible. And it's also, again, a shameless plug for folks to come work. But
Yeah.
more importantly, it's an opportunity for folks to feel seen,
Yeah.
heard, and understood, and to know that folks matter and care. And so members of the recovery community are encouraged to apply because, again, that first entrance, that first person,
Yeah.
to know that, like, you get me.
Yeah.
You've been there. You've had some pretty, can't cuss, I'm not going to say it because my family's watching, but some pretty messed up moments in my
it's
life.
the recovery community,
Right.
right? Like,
But my dad's going to watch this, Brad. So can't cuss in front of him. Sorry, Dad. But, knowing that there are some, not so good points in your life and to say, you get it. Like,
Yeah.
you've had some not so maybe good points,
Yeah.
but I know that it's possible
Yeah.
because, you are living proof that it's possible.
Yeah.
And this is a resource that can help me stay on track or get started or maintain or whatever the case may be.
yeah. I think about like for people who are out there struggling and what it feels like to really like get that past that first step, right? Like, and that first step for some people seems like such a hurdle, right? And really what I think about crisis care centers, the way you describe them, is it's really making that hurdle like flat. And it's still like a difficult step to take, but that step is so much less daunting.
Yeah.
That step is so much more accessible.
Yeah.
And it's so much more unconditional.
Yeah. Fear of the unknown keeps us stuck a
yeah,
lot.
yeah.
And so oftentimes I rather stay
Yeah.
in the way my life is,
Yeah.
even if it is chaotic,
Yeah.
because I know what to expect.
Yeah.
There's normalcy within my chaos.
Yeah.
And so you're offering me a resource. I don't know what to expect on that other side,
Sure.
right? And
Totally.
so crisis care centers, like you said, lower that,
Yeah.
make it, more welcoming to say, I may not know,
Yeah.
but maybe I'm willing to walk through that door and see what it's like.
Yeah. So we're almost at time, and I have 20 more questions. So we might have to do this again, maybe like when the next one comes, when the
let's do
next
it.
crisis care center gets up and running. But 7 years from now, 10 years from now, looking back upon this journey of starting up crisis care centers, like what do you think the story will be? Like, what do you think the story that will be 10 years from now about this journey that you're on to set these up, and what could be possible?
I think the story I want people to know is King County cares.
Yeah.
Right? Like,
So
again,
good.
they voted for
Yeah.
this.
Yeah.
They said, we recognize that there's a problem in our community. We want to invest in this. And in 7 to 10 years, I want folks to look back and say, wow, there was a problem. We were solution focused.
Yeah.
We jumped in.
Yeah.
We supported. And now folks have an opportunity, because again, how many of us have loved ones that
Yeah.
will likely experience a crisis?
Yeah.
And now I have somewhere for them to go.
Yeah.
And we are setting that model of care, again, slight flex, big flex, whatever the case
Yeah.
may be. This is a first in the country.
Yeah.
There's not a network of crisis care centers. And so we are essentially saying this model of care
Yeah.
is going to be the best model of
Yeah.
care moving forward.
It's so exciting. I'm super excited. I was excited before we were having this conversation, but just hearing about the possibilities, right? And about the transformation. I just appreciate the authenticness. I appreciate the transparency. And I really appreciate y'all thinking about this as good stewards of the public's confidence, of the public's resources, and the public's investment.
Absolutely. I'm part of this public, and I want to know, where's my money going?
Yeah.
What are we actually doing? I drive, I live, like I said, in South King County.
Yeah.
I see it, and I'm like, what are we going to do about this? Like,
Yeah.
There's a problem, and what is the solution?
Yeah.
And so while this won't fix the system as a whole,
Yeah.
it is a really great start of providing resources, and,
Totally.
we can just keep building on that.
Yeah. Yeah. All right. Any last words for the recovery community out there who's watching this? And also, you can give love to your parents. Hi, Jennifer's dad.
Yes. So one, I'll say, stay involved. We have a newsletter, there is the Behavioral Health Advisory Board. We have a community engagement liaison that's out in community that is willing and eager to come talk to you. If you have an organization, if you have people, just let us know. I could hold up a sign with email us at this, but we'll put that in the comments.
Yeah.
But we want to hear from you. This is something that we want to be successful. We don't want to set up buildings and, nobody comes to set buildings.
Yeah.
And so we want folks to come. We want folks to work there. And so I just, as much as I don't like public speaking, because I don't, fun fact about me is I find myself every time I'm in situations like this, I'm just so humbled because I actually get to stop and say what the work that we're doing.
Yeah.
And I'm just in awe of wow, we
Yeah.
really are doing some great stuff.
That's
right?
so great.
It
That's
is.
so great. So just because we don't have cue cards and I don't have a QR code to hold up. What's is there a front web page or something like that folks could go to engage if they do have feedback, if they do want to engage with y'all anyway? Can you let folks know that?
Sure. I would give you Brad's personal cell phone number, but you probably don't want that. We do have an inbox, ccc.levy@kingcounty.gov. That is a really great entry point. I mean, you could also just Google King County Crisis Care Centers, and there's a slew of information, but we do have an email, ccclevy@kingcounty.gov, and we do have someone that can kind of get you connected to the right person or the right resource. If you want to learn more, if you want to join our listserv, again, a blog, a newsletter, yeah, that's going to be probably the best way.
Awesome. Well, I just want to thank you personally, Jennifer, for not only spending this time with us talking about this like transformational endeavor and effort that the county's going through with the crisis care centers, but I also want to thank you for your work and your heart. You're an amazing person, not like an amazing person, but you are an amazing person, and knowing that the team you work with is just that this is in good hands, and that this will be done right and authentic for the community.
Absolutely.
I just want to thank you for all that work that you all have put in, that you're going to be putting in over the next chunk of years to see these get set up right, and get people the care that they need. So thank you.
Thank you. Yes, definitely a team effort. And I brought you a gift because I know how much you love the levy. I brought you your very own implementation plan.
Oh my goodness.
So it's a little bit of light reading. So yeah, go home when you're like on the train, on the bus. I didn't autograph it for you. I should have, but I didn't. But a little light reading for you.
Thank you. I don't quite know what to say. I've never been given a gift like this before, but I appreciate it. Thank you. And folks, if you are also interested in this amazing implementation plan, I'm sure that if you email the Crisis Care Center,
it is online.
It's online.
You can totally have
have
access
to
this.
Yeah.
But I'm an old school girly, so I still love a good like printed.
I appreciate that.
So that's just for you.
Good looking out.
Thanks for having me today.
Yeah, no doubt. And everybody who has taken the time to listen and talk through and hang out with us today, we appreciate it. On behalf of the Washington Recovery Alliance and the King County Recovery Coalition, thank you, and have a great day.
Thank you.